Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Amith, consultant cardiologist from Bangalore, and today we are delving into the silent epidemic that India is combating, that is heart failure. So, in India, the majority of patients grappling with heart failure are surprisingly younger individuals, and it's a common occurrence to witness young adults seeking medical assistance for heart failure. This, unlike the Western countries where heart failure is predominantly a disease of the elderly. So, let's break down 5 essential insights on heart failure. Firstly, what does it mean when a doctor tells you that you are having heart failure? So, when a patient gets a diagnosis of heart failure, they think that it's the end of their lives because the term heart failure can seem frightening, but it simply means your heart is struggling to pump blood as efficiently as it should, or another spectrum wherein the heart is unable to relax as it normally should. The ejection fraction or EF measures how well your heart pumps blood. So it is the amount of blood pumped out of your heart's lower chambers, that is ventricles, each time when it contracts. While a normal EF is around 50 to 70%, individuals with heart failure typically have EF of 50% or lower, and another variant, that is heart failure with preserved ejection fraction, usually have normal EF. So next, moving on. Secondly, why are so many Indians affected by heart failure? Genetics play a significant role. Indians are genetically more vulnerable to cardiovascular diseases. And to add to it, hypertension, diabetes, obesity, and smoking worsen this epidemic. So, moving on, what are the signs and symptoms of heart failure? So, whenever a patient is being diagnosed with heart failure, or to facilitate an early diagnosis of heart failure, there are few signs and symptoms one has to look out for. These are confusion, fatigue, palpitations, nausea, difficulty in breathing, and weakness. Few patients may also experience loss of appetite or vomiting. Next, how can we protect ourselves from this disease? Our heart is very unique because it works incredibly hard to keep us alive from the time we are born till we are gone. So, these are the 5 golden rules which one can follow to return the favor to our hearts. Number 1, early detection of heart failure through regular blood test, specifically BNP or NT-proBNP. Secondly, dietary adjustment to maintain heart health. Third, incorporating daily exercises into your routine. Number 4, practicing stress management techniques. And finally, quitting bad habits like alcohol, tobacco, and smoking. So, lastly, what comes next after a diagnosis of heart failure? Thankfully, medical science offers numerous treatment options currently, so it is possible to lead an enjoyable, meaningful, and a productive life. Heart failure medication improve the quality of life and our longevity, and there are few devices like biventricular pacemaker, also known as cardiac resynchronization therapy, implantable cardioverter defibrillator or ICD, or repair of heart valves and replacement. And as a last resort, heart transplant also is found to be beneficial. So the lifetime risk of congestive heart failure is 1 in 5 for both men and women. So remember, awareness and proactive measures are key in combating this silent epidemic. Thank you.